Hi guys. Unless you live under a rock, you might have heard that United Kingdom recently has had a huge spike in the number of coronavirus cases. It is estimated that at this moment of time, 1 in 30 people living in private households in London are infected with COVID, and I am sadly one of them. It all started with quite high temperature, feeling feverish along with severe shivering. In fact, the chills was so intense that I was wondering if by any chance I've contracted the malaria, because I did visit India a few weeks ago. Along with this, I had the usual symptoms of headache, muscle pain, bone pain. It felt like every single cell of my body was crying out loud. I immediately segregated myself from my husband. I confined myself to our bedroom, which has an ensuite bathroom, and we had decided that if I do test positive, this is where I'm going to spend my isolation period. The following day, I got a slot for my coronavirus testing. We have a slot system operating in NHS in the UK, and in addition we can also request for a home swab test kit and send it by a mail, but going into a drive-in facility was easier for me. So one of the parking lots in Heathrow Airport has been converted to a drive-in testing center. That is where I went. My swab was collected. It was sent for RT-PCR, which is the gold standard test for diagnosing coronavirus. Within 24 hours, in fact, the report came back, and unsurprisingly, I was positive. Now, a few people have asked me if this is the new strain, the UK variant as they call it. My honest answer is I do not know. When we receive the report, we are only told if it's positive or negative. Any information from genetic sequencing, if done, has importance for epidemiologists and public health officials, because based on the trend, they make important public health policy decisions. But to me, the patient, and also when I'm the doctor, that information holds no value, because it is not going to change the management. It is going to be treated exactly in the same way. So to answer that question, I don't know and I don't care. Anyway, so apart from the first night, I really did not have any fever, thankfully. I felt feverish for the next couple of days, but my temperature had always been normal after that night. I got nauseous, I totally lost my appetite, my headache persisted, body ache too, and from day 2, the predominant symptom that I developed was sore throat. It was so bad. I mean, growing up, I had the usual bouts of tonsillitis, so I know how a sore throat feels like. It's not an alien concept to me, and I really have very high pain threshold. I'm not someone who, cries easily or gets very flustered at the slightest of symptoms, but this was at a different level. Honestly, the best way for me to describe it is I felt like someone had stabbed the back of my neck and was constantly moving the knife up and down and sideways. It just felt like every single second the back of my throat was being ripped apart. There's no way for me to describe it better than this. I couldn't eat, I couldn't sleep, I did not have a moment's respite. It just carried on, and along with it, I completely lost my voice. I could not even whisper. At some point, I was afraid that I'll have to give up my career, because if I can't speak to my patients, how can I practice medicine? So it was very painful, very uncomfortable, and scary too. If you know me personally, you probably would know that my husband, sadly, a few weeks ago, he lost his dad to COVID. So as a family, we haven't had much luck with this disease, really. Coronavirus, unlike many people across the globe, to us, it's not just a virus which causes flu-like symptoms. It's a very real disease that can kill, as we have sadly experienced. once I tested positive, there was a lot of anxiety surrounding it. Even though I'm quite a stoic person, and even as a doctor, I've often been told that I don't panic, and I really do not panic. But in this instance, I don't know what happened. I could not let go of all the negative thoughts that kept coming to mind, and on a couple of occasions I ended up having anxiety attacks, which makes things more difficult, because when you have anxiety, your respiratory rate increases, you feel breathless, you have palpitation, you feel like your heart is racing, and these are also things that can happen with coronavirus. So that got me really confused as to why I'm feeling breathless. Is it because of COVID, or is it because I'm of anxiety? Do I need to call an ambulance? Do I need to contact 999 emergency number? Do I need to tell them that I'm feeling breathless? Luckily, I have got a pulse oximeter in my phone. Both Vikram and I use Samsung Galaxy S10 Plus phones, and there is an inbuilt pulse oximeter in it. So I kept checking my oxygen levels, and they have been normal. My heart rate has been slightly on the higher side. My resting heart rate is around 60-ish. So even if I get a constant heart rate of around 80, that is on the higher side for me, which probably is expected, because I had an inflammatory condition going on in my body, an infective condition, and I was also quite worried. That could explain the heart rate, but the oxygen saturation thankfully had remained stable, so I did not escalate. But yes, one of the things that I would advise if you do test positive for coronavirus is that panic, anxiety, worries, these can mimic the signs of breathlessness of COVID. So one has to be careful in carefully eliminating that. After, I guess, 3 or 4 days, I started having diarrhea, which wasn't too significant, but it did last for a couple of days. And oddly, I lost the sensation of salty taste in my mouth. So I could taste everything else apart from salt, which is really very weird. The predominant symptom that persisted and which still is ongoing has been fatigue, extreme fatigue. So much that every simple act felt like climbing a mountain. I woke up in the morning, I thought, oh, today I'm going to conquer the world. And then I went to brush my teeth, and I got so exhausted that I had to take a couple of hours nap. One day I remember I had breakfast. I felt quite sprightly. I had breakfast and I told my husband, look, I need to take a little bit of break, and then I'll see, and then you can drop off my lunch in a few hours time. And I fell asleep. I slept for 10 hours. When I woke up at 8 o'clock, or probably it was 10 o'clock at night, I was totally surprised, because that was not my intention at all. But the act of eating breakfast made me so exhausted that I had to sleep for half a day. So it is that level of fatigue that you can experience if you do have COVID. Today is day 11 of my symptoms and my last day of isolation. And from this morning, I can't smell. I've lost my sensation of smell, so that's new. But however, the sensation of smell can take weeks to come back, so I'm not worried about my infectiousness. I know I've spent enough number of days, so I'm not infected anymore. I still have a little bit of cough. In fact, I should have mentioned that cough has also been one of the symptoms, but it wasn't too intense, even though it did persist at some point in the course of the few days. But once again, cough is also a feature that can persist even when you're not infectious. Infectious means when you're no longer at a risk of transmitting the infection to other people. So I guess I have to live with this for a few more days or weeks if I'm really unfortunate. So how did I address my problem? Now at this moment, there's no treatment for coronavirus. There's no antibiotic as such. Managing COVID infection is done by what we call as symptomatic method, which means that we try to address the symptoms, because that's the best we can do really. So when I had fever, when I had the body aches, I took paracetamol. For cough, I really did not want to take cough syrup because cough is a protective reflex. It helps to get rid of all the impurities from the respiratory system. But at some point, I needed to have the cough syrup because it was getting a bit too annoying for my comfort. But the one thing that gave me the most grief in all of these days, the sore throat, that took a lot of effort to address. I tried local anesthetic spray, anti-inflammatory spray, gargling, of course, with hot water, with mouthwash. Then I tried having paracetamol tablets. I mean, I tried all of these, but nothing seemed to work properly. Then one night I called the urgent care number of United Kingdom, which is 111, and they advised, I called them and I said that, look, I know it's not urgent, I don't need to go to the hospital, please give me some advice, what else can I try? And they suggested I gargle with dispersible paracetamol tablets, which miraculously worked. Or was it a combination of everything else? I mean, I can't pinpoint, but every few hours I slapped my body with all the sprays, all the gurgling and the dispersible paracetamol, and that gave me slight relief and I could finally rest for a few hours. Otherwise, I was getting no sleep at all because of this constant pain and discomfort in my throat. By the end of the week, it improved significantly and I could see some light at the end of the tunnel. My voice also came back after a week, but in the initial first few days, I was following the advice that I found in a video that was published at some point by one of the NHS hospitals, I think from Manchester. I'm going to attach the link up here. Apparently, it's not unheard of losing voice from coronavirus, and they have a few tips to combat it, and it worked. So if you're one of the unfortunate ones like me, you can try these out. For diarrhea, I obviously didn't need anything, but I made very sure that I was well hydrated throughout the course of my recovery, because the last thing I wanted to do is dehydrate myself and cause further complications. Now, since I'm a doctor, I think probably the situation was slightly easier for me because I knew the red flags and I could make clinical judgment calls based on my condition. If I wasn't a doctor, I perhaps would have been more worried because there'd have been too many things that I could not comprehend. But then being a doctor also adds to the anxiety, because the more you know, the more anxious you can become. I had a hard time feeling of negative thoughts and not thinking about the possibility of blood clotting in my lungs or fluid accumulating around my heart and all the weird and wonderful things. So anyway, that was my recovery from coronavirus. To be honest with you, I feel very disappointed that I contracted it. Of course, it's no one's dream, at least I hope it's no one's dream to get coronavirus, especially for me, because I have been so careful with cleanliness, hygiene, social distancing. I've always diligently worn my personal protective equipment, and those who know me would know that even outside this whole COVID business, even before the world got to know about coronavirus, I was always very careful about hygiene. In fact, my family members seem to think that I have some sort of an obsessive compulsive disorder going on because I'm so particular about cleanliness. In spite of that, getting infected, it was a bit unfortunate. I thought I had managed to somehow save myself by not getting infected in all of 2020, and I was so close to getting my vaccine. But I guess there are just too many coronavirus patients in London at the moment, and it's difficult to escape it. I don't know any of my colleague in UK or in India who hasn't had coronavirus. So for doctors, we do know that it's a high risk. I've got two risks, in fact. One is that I'm a doctor, and the other risk for getting severely sick with coronavirus is my ethnicity. Thankfully, no matter how much pain I had to endure and how uncomfortable I was, it still was within the parameters of a mild illness. One can never know. The problem with COVID is that it's not possible to predict who's going to get how severe manifestation and how bad it is going to be for whom. So one really has to be very, very careful. I spent New Year's Eve in isolation. So this is my bedroom and this is where I spent. And when I said that I kept myself separate from my husband, I really mean it. He used to leave food at the door and then knock and leave. I opened the door, took my food, ate, and then I washed my dishes and kept it in a separate bowl with soap water. So which he took immediately, put it in the dishwasher, and he washed his hands. That's the only contact we have had. We haven't had any face-to-face contact. Even when I could not speak, we could not communicate because I couldn't speak on the phone. So we have been really very careful. Thankfully, Vikram is well. I think the other thing that worked for him is that he has been a volunteer for one of the vaccine trials in UK. And in vaccine trials, you don't know whether you're getting the vaccine proper or placebo. We are guessing and we are hoping that he was in the vaccine arm, because the most infectious period with COVID is a few days before you actually start getting symptoms. And that was the weekend over Christmas, which was a long holiday weekend for both of us, and we literally were joined at the hips. In spite of that, the fact that he has been okay, touch wood, has been very reassuring, and we think that it is because of a vaccine that he might have got. So that's one more point that goes towards vaccine. Unfortunately, my vaccine inoculation date is now delayed because I got the infection and I now have to wait for 4 weeks. But hopefully my body has produced enough immunity to last me for the next 4 weeks, and then I'll be protected with the vaccine. So that is the grand plan. The other thing that I'd like to talk about is medical research. This virus has been around for a year, but there are still loads of things that we need to learn about it in order to properly address and save many more lives. And the way to do it is by promoting scientific medical research. When I got my positive result, the email also contained a link of all the research activities that are going on in UK right now, where I can contribute, and I pretty much registered for all of them. Even before this, both Vikram and I are part of a few COVID-based researches that are ongoing in UK. But anyway, these are specific for people who have tested positive. I've already provided my input for one of the research projects. Hopefully the others will contact me, and the information that I provide will be vital for them, especially for us minority ethnicities. For Indians, we often complain that there's not enough data that are tailored for South Asian population. I mean, one of the reasons is because we don't volunteer as much to medical research. Somehow it's not cultural for us. So it's more important that we come ahead and we help to gather enough data that will make managing coronavirus in South Asians easier and better. So that's all. Please stay safe, everyone. I mean, you really have to be very careful. If you're in UK, definitely we are in lockdown again, unsurprisingly. But if you're in India and you think, oh, I don't need to worry about these, let the selfish NRIs deal with it, then I'm really sorry, you're wrong. I mean, every single day I hear of people dying in India from COVID. So be very, very careful. Even if you're mixing socially, my advice will be to mix outdoors, and please, can you maintain social distancing. Masks obviously are mandatory, but a mask is not a replacement for social distancing. You can't wear a mask and then go on hugging people and taking group fees. It doesn't work that way. It has to be a combination of wearing a mask, maintaining meticulous social distancing, and also hygiene, washing your hands. So a combination of all of them may help to protect you. If you're young, then even if you get coronavirus, you might be all right. But there may be vulnerable people at home who may not be able to make the journey back home if you're not careful. So I'm sorry, I know I'm sounding like a scaremongerer, but that's the truth, as we have learned the hard way. You don't want to suffer like we have. With that note, I'm going to end the video today. Please take care and bye.